All right, so we're just going to get started. Good evening, everyone. Welcome to today's session on demystifying internship. And I think these are very important session for you guys. This is something that has not been done before. And we thought that as YPG, the Young Pharmacist Group, we should be able to create something that will at least will enable you to transition from your graduation to your internship easy. So in this meeting, we're going to be discussing a couple of things that are really important during your internship, and that is the pre-internship MOH PPB documentation. These are the documents that you'll be submitting to the Ministry of Health before you start your internship. And we'll also be having a session on professionalism and ethics, and that is going to be covered by none other than our CEO at PSK, that is Dr. Lucas Nyabero. And finally, tomorrow we're going to be having a session on internship rotation areas. We're going to delve deeper on the different sections that you'll be going during your rotation. And finally, financial wellness. So first of all, I'd like to invite our chairperson, Dr. Cohen Andove, who is going to have a few opening remarks. Dr. Cohen, if you can hear me. Dr. Cohen Andove. Cohen, can you hear me? All right, just to save some time, maybe we could just go on into the first session of today, and we'll have Dr. Cohen joining in later to give his remarks. So on the agenda today, we have a session on professionalism and ethics, and that is going to be facilitated by Dr. Lucas Nyabero, who is the CEO for the Pharmaceutical Society of Kenya. So Dr. Lucas Nyabero, if you can hear me.
Loud and clear, loud and clear.
All right, thank you so much. I think you could go ahead and...
Sorry, Hez, I'm here. Can you hear me now?
Okay, I see Cohen is here. Sorry, Dr. Lucas, maybe Cohen could just do the opening remarks, then we can...
Absolutely, go for it.
All right, thank you. Cohen.
Sorry, I had some tech challenges on my side, and I think I won't even be able to join with my camera. But yeah, I'll pick it up from there and I'll be as brief as possible. So my esteemed colleagues, my esteemed senior Dr. Lucas, and all the other people who are, the other pharmacists who are going for your internship. My name is Dr. Cohen Andove. I'm the chairperson of the Young Pharmacist Group, and I'm happy to have you guys on board today. So like the title says, Demystifying Internship, I know we got word from KMPDU that you guys are supposed to collect your letters from the Ministry of Health to begin your internship tomorrow, 16th. So hopefully, I hope the ministry will stick to their word. And if that's the case, that's why we're here for you. And we have this 2-day series of Demystifying Internship. Today, we are glad to be joined by the CEO of the Pharmaceutical Society of Kenya, Dr. Lucas, and our young pharmacist, Dr. Aden. As it shows on your screen, we're going to take you through two main agendas. Dr. Lucas will talk about professionalism and ethics, and Dr. Aden Siyat will talk about the documentation, what you'll need, your internship changeover, how you'll fill your internship diary, and all that. So I'll just give you, I want to give you guys just one scenario before I hand over to Hezon, and so that Dr. Lucas can now take over on the part of professionalism. So today in one of the WhatsApp groups that has pharmacists, there was a discussion of how a 75-year-old female walked into a pharmacy. She was coming to refill her antihypertensive drugs. So she told the pharmacist that her blood pressure is okay. Why does she need to continue, taking these antihypertensive drugs? So now the pharmacist, luckily the pharmacist stepped in and told her the importance of continue taking her antihypertensive drugs, despite the fact that her blood pressure had stabilized. So from there, the pharmacist told her how it's important that she continues taking her drugs so that it reduces workload on her heart, it reduces workload on her kidneys as well, and went and comprehensively explained to her the importance of continuing taking her antihypertensive drugs so that it improves her quality of life. And in the end, that patient smiled and continued to take the drugs just as it was prescribed. So what am I trying to say? When you guys are going for internship, I know we have had problems with, we're talking about why is there unemployment? Why are people not employing pharmacists? First of all, are pharmacists available? Are pharmacists accessible? I hope when you guys go, you're going to show in your respective industries, hospitals, and in your community practice and even primary healthcare practice. Please go there and show why we need pharmacists there. We need to have a narrative and show the whole country why we should be there. And on that note, I hand it back to Hezron.
All right, thank you so much for the opening remarks, Dr. Cohen. Now we're going to move forward to the PSK CEO, Dr. Lucas Nyabero, who will take us through professionalism and ethics. Welcome, Dr.
Thank you very much. Thank you very much. Can you guys all hear me?
Yes, loud and clear.
Yes.
Loud and clear? Good. Give me 1 second. Let me. Apologies for this. So that's much better now. So, ladies and gentlemen, fellow pharmacists, colleagues, first of all, I would like to congratulate you, Pongezi. Congratulations for getting to where you've gotten to. At the same time, this is when work starts. So you think you've been working? No, this is when it starts. The story that Cohen just gave was a very interesting story. There's a lot of nuances in that story that makes a difference. That lady, whoever the patient was, next time they come to the pharmacy, they will not talk to anybody else. They'll look for that particular pharmacist because that pharmacist just changed her life. Okay, those are the things you got to do. Those are the intangibles. Now that pharmacist maybe was had classmates. And it's not what you got in school. It's not the A, it's not the C, it's not whatever it is. It's the fact that now you have someone's life in your hands. How do you handle that? How do you take care of that? So I'm going to go through a few things here, and I want to go through them pretty. And then I get very passionate about this, so sometimes I sound like I am yelling, but I'm not. I promise you. I'm a colleague. That's why I called you colleagues originally, because I know you understand what I'm talking about. So, number one, professionalism, where does it start? It starts by how you present yourself. Now, presenting yourself includes how you dress, yes, but most importantly, how you address people and how you deal with people. So once upon a time, there was a guy called Rockefeller in the US, one of the richest people in the US, and he had two people that he took for dinner, because both of them, he wanted to give them very high positions in his company. Took them to dinner, and after dinner, he told one, you will take the position, you cannot take the position. And the other guy was quite surprised. We both came to the Ivy League schools, we put good grades, blah, blah, blah. Why did you choose my colleague here? He said, simple. There were two things I was watching for. One, you added salt on your steak before you tasted it. You put salt on your steak before you even tasted it. So he said, one, I don't like people who change things before they taste them, before they understand what they're changing. So that's number one. Number two, anytime the servers came around, you were very respectful to me, but you did not show them the same courtesy. So you didn't show courtesy to those who, quote unquote, you deem less important than you. And you changed things before you checked whether you need to change them or not. In essence, what you're trying to say is you need to learn your environment before you move it. You need to learn what you're doing before you change it. The other thing is that please be respectful, be courteous. That's very important. That's part of professionalism. The other thing is timekeeping. A lot of times, and those people who I think I had a privilege of teaching some of you, time was something that really drives me nuts. When you say you're coming at 10, please be there at 10. If it's a patient who's expecting you at 10 and you show up at 10:30, you've lost that patient already. They're pissed off because they have other things to do. If you were the patient, you wouldn't want that too. So a few things I'm going to go through, and if you're writing notes, one, time. Ensure that you keep your time. If you have an appointment, you're supposed to appear for your rotations, for your internships at 8, please don't come in at 8:01. Come in at 7:45. Put your time, everything. Just put it in your head that you're supposed to report at 7:45. That makes a difference. I'll give you an example, and I don't know whether I'll put it here. So when I was doing my rotations in school, I remember a case, and this is why coming early is an important thing. So I was working at UMass, University of Massachusetts Medical Center in Worcester, and I was working at the ICU, and I think I had between 12 and 16 patients every day. So my rotations, we used to go for rounds at 7:30. I used to get there between 5:30 and 6 in the morning. That's about an hour to an hour and a half earlier than time. Because I didn't want to let down the profession, and I didn't want to let down my professor who was going to be there, and I didn't want to let down, most importantly, the patient. So I'd get in at that time, then I'd do my own rounds. So my rounds included going to check the labs, check to see how the patient did all night, and then I would check and see, are the drugs okay? What was the situation like? If there are any images that were done during the night, where are the results? What am I seeing that's unique? Then I would go ahead, if there's any changes that need to be done, I would look for the evidence. So I'd say, hey, let's change from carvedilol to propranolol because here's the evidence that I found. And because of this reaction, and this organ is doing this way because of these labs, so that when you give a result, when you give a recommendation, it is backed up and it's strong. One of the other things that I used to do that I think was most important is I had a chance to talk to the family members of this patient. I remember one patient who was absolutely, he was anticoagulated, and he for some reason his INRs were crazy high. So we kept on wondering what's going on. So the patient actually came in, was in ICU because of the condition. And we kept on wondering, this is somebody who comes to the clinic, we've been seeing him, but he shouldn't be here. So one of the mornings I got in, and I'm really bracking my brain. So I found the wife and I said, hey, how are you doing? We started talking. And I said, hey, tell me something. What does he do at home? What is this diet like? So she went ahead and she said, you guys told us the salad should go down, and we stopped that. However, we also do this. I said, what else does he have? Oh, yes. Since he was, I don't know what age, he's been drinking this. He was told that this will help him lose weight. So he drinks this juice that had spinach and has beets and something else. I said, what? So this guy has been taking this juice. When he comes to the farm, when he comes for the testing, when we were doing the INRs, we kept on increasing the dose because it wasn't working. The Coumadin wasn't working. So we kept on increasing the dose to a point where we pushed him overboard. So that little information, I relayed it when we were doing the rounds. and everybody, it clicked why we were having an issue controlling this patient. Those are the things that make a difference. If you show up rotation or the rounds at 8 and you're showing up at 8:01, first of all, the bus has left you. Secondly, you don't have the confidence to say what you need to say about that patient. Number third, you're cheating that patient. You're supposed to be there early to understand what the patient's challenges are and provide valid, appropriate interventions. So please, if nothing else, that's number time. Make sure time is there. Number two, make sure you do your homework before you present to whoever is being there. And as you do that, I'll tell you something for a fact, and you can ask your physician friends. A good physician knows between 10 and 15 meds very well. They use way more than those medications. You are the drug expert, you should know. So if you can support them in their medication choices, that improves patient outcomes. That gives them more time to see more patients. So if you are able to take the prescribing of drugs away from a physician, you form a team. So now he starts trusting you, and the more he trusts you, the more we're building. The more now they'll understand the difference between having a technician and having a pharmacist in the hospital. Right now, they don't see a difference because you're competing with them at a level of counting. You're not competing with technicians at the knowledge level. And the only way you can do that is if you step up and do more than you're doing. Now, the profession is where it is because of mistakes that were done before. I'm not going to sit here and say, oh yeah, it's okay. No. There's some mistakes that were done in the past. We can't sit down and cry over those mistakes. Mistakes happened, they happened. This is the generation, your generation is a generation that's going to restore pharmacy to where it's supposed to be. I am here to support you, and I hope we can work together to do that. The knowledge base. You have been in school. Some of you, I'm sure, some of you have just been cramming to get your grades. That's good. You've got your grades now. Now it's when you have to extrapolate and implement. Whatever you learned, now it's not a joke. It's not about an A now. It's about someone's life. Yeah. I want you to feel the weight of that. It's not about your grade anymore. It's about someone's life. And that person could be someone's dad, someone's brother, someone's mom, someone. It is about life now. So the knowledge that you did not get, the knowledge that you, during exams, you looked over to see what your friend has, or you worked together to do an exam. I remember that's an issue some places. It's now, those cows are coming home. Those cuckoos are coming home to roost. So please, if you did that, good, you're here where you are now. Please work on your knowledge. Work on your knowledge base. Because if you have the knowledge base that you should have gotten, there is absolutely no reason why somebody should prefer a technician who has done 3 years less of school than you. So the key thing is not the knowledge. We know we should have the knowledge. Is now talk about how you practice it. How do you put it into practice? How do you extrapolate what you learned and put it into a patient care situation? So if your knowledge is questionable, don't worry about it. Just work on it. You have time, you're preparing for exams, for your licensing exams. Use that to build yourself. The other good thing that you can do about knowledge gaps is know your patients early enough, go through that. As colleagues who went to school together, find a communication system where you can share information about how to, on anything. So if you get stuck, who can you call? Who can you mentor? You can mentor your colleagues too. Okay, time, rotations, knowledge base. Number 4, creativity. Creativity. We are trying to create opportunities for you. Your colleagues who left before you, majority of them don't have jobs. Yet, there is, technicians cannot, the technicians get jobs immediately. Okay, so what am I saying? Once upon a time, there was I don't know whether she's here. One of my students at USIU was at a rotation site. where when I went to visit her, she said, yeah, they're misleading patients. They're telling them stories that are not true. I'm sure some of you are going to see this because unfortunately, some of you are going to be supervised by a technician. Let that sink in. Technician has had less information, less school time than you, but they're going to supervise you. We want to make sure that they trust what you do. So what do you do when they do things? Don't fight them. How about this? You're going to rotations. Don't be happy that there's no work to do. Look for work for yourself. Creatively look for opportunities. If they are misleading folks about high blood pressure medications, just tell them, hey, part of my learning is I need to give you guys a talk about some medications every single week, twice a week, 3 times a week, whatever you choose, make it up. And every time, make a presentation. It can be a 5-minute presentation on what are ACE inhibitors? Why should you get an ACE inhibitor? What are the ACE inhibitors in the market? What are the interactions with ACE inhibitors? You show them that bloody hell, I have this knowledge. And you also be approachable. Remember, I began about the Rockefeller's experiment with 2 students. So please, don't show them that I am bigger than you, whatever it is, that's all rubbish. Just make sure you show them, I have the knowledge and I'm willing to share it with you. So if a patient asks for this and this is what it happens and this is why. So you bring depth that you know they don't have, but not to intimidate them, but just to tell them, I am here as a resource. If a patient, and actually even in your presentation, say, if a patient comes and has a question you can't quite understand, or a question that is not quite clear, I'll come and help. I'll come and help, I'm here to learn and I'm here to share the knowledge I have. And I'm going to share it for free. And those are some of those tricks, quote unquote, creative ways to create opportunities. You could get to a point where the technicians themselves say, we need to have a pharmacist here because of the questions they're asking the patient. Patients' outcomes are going to be big. For us to achieve UHC, patient outcomes have to come on top. For patient outcomes to be met, we have to know what medications patients are taking, how they're taking them, interactions, food-drug interactions, drug OTC interactions, and other things. Technicians do not have the knowledge base that you have. That's not to say that you're more special than them. No. It's just that the situation is that way. So what we need to do is, how do we work that back? And that's what I'm asking. So how do you creatively create an opportunity? Here's another one, not even rotations. I think I've told a few of students this. Where you live, there's a physician there. Almost for certain. Suppose you can go there and say, get me your 3 most complicated diabetes patients. We'll do an A1C now. I will offer my care for 3 months or 2 months. For 2 months, for a month, I will monitor the patient and talk to the patient, and then we can do another A1C. And you also now move back to the patient, you look and see what they're doing, you look at their diet, you look at their medications. Are they compliant? Why are they not compliant? All those are questions where now you take over the therapy of the patient. And you monitor everything. You monitor from what to the A1C, you monitor the blood sugars, you monitor the medications, are they taking them on time? You monitor any side effects, and you even call them, say, hey, did you take your medication today? Yes. How did you feel? Did you fall? What are the things that happened? And you document each and every step. When you document, you're forming a record. After a month or 2, you go there and show the physician, whoever you're working with, here's what I have tabulated on this patient. This is what they have done. This is what we changed. This is how we encouraged him. And I'm sure he understands his condition now, and the outcomes are going to be better, which is a fact. When you do that, you've now taken the fight, quote unquote, above whether you should be standing in the pharmacy or not. You've just shown this physician that for outcomes to be good, we need to work together. I can work with you on this. And then now he starts and just say, if I come here and I'm helping you with prescribing, then you have, I'm allowing you to see 5 more patients at the end of the day. So if you used to see 20, you can see 25 or even 30, because now what you just do, diagnose and then send me for me to write the prescription. That, ladies and gentlemen, is what MTM is supposed to do. MTM, medication therapy management. The new word now is pharmaceutical care. That, ladies and gentlemen, is where we make our money. When you go see a physician, they normally tell you knowledge that's in their brain. They tell you, tell me your symptoms and I'll tell you what your diagnosis is. What I'm saying is, tell me your diagnosis and I'll tell you what the best meds are. And that's what you need to do. Your colleagues don't have positions. They're struggling. You're going out there. Please forget everything they told you about now that you're a pharmacist, blah, blah, blah. They gave you a title doctor, yes. That does not mean you get a job. You have to be creative enough to create an opportunity for yourself. Now, my generation of pharmacists, and probably ones who are above me, did not carry that weight very well. And that's why we have situations where pharmacists are not where they're supposed to be. We can sit down here and whine about it. But bloody hell, it's not going to help you. If you whine about it, you whine and whine and whine. That and a cup of tea, that will not even buy you a cup of tea. Let's now change this. Let's be known as the generation of pharmacists that changed, that put the pharmacists back on the map. I am willing to work with you as hard as you want. I am going to be here and I want you to succeed. I care about you professionally. I care about the patients you're going to see, and I care about the pharmacy profession. I am very, very, very passionate about it. Very passionate about pharmacy because I know the difference. I have done it. I have played it. I've seen it. I have actually worked as a pharmacist, as a clinical pharmacist. I've owned the business. I have worked as a pharmacist and I've seen what the difference it can make. Creating opportunities. Pharmacogenetics is something else that's coming. You guys got to learn that. You got to learn pharmacoeconomics. What is a drug? What drugs are going to be best for this patient that then they cannot go broke? What are some of those things? And those are the things you tweak and show the physician and say, hey, you know what? If we give this patient this and this, the cost of those two is lower than this one. Oh, this patient works in Django, cannot stop in the middle of the day to take a medication. So why don't you give them a twice-a-day medication? That is now when therapy fits in to the patient's lifestyle, not the patient to fit into the drug lifestyle, because that's when compliance goes right out of the window. Now, compliance is very important. You all have heard about NCDs, non-communicable diseases, which is where we are going. If you walk in town, you'll see people are kind of hefty. People have eaten well. When people eat well, we start thinking of what? High blood pressure. We start thinking of uncontrolled high blood pressure, because a bunch of people who walk down the streets of Nairobi or any other city that you're in have uncontrolled hypertension. I can bet you that. I can bet you there's a lot of people who walk around who are either pre-diabetic or diabetic, who are not monitored. I will bet you that, and you will find it. Here's the other one that's coming. Neurological diseases, ALS, right? Lou Gehrig's disease, Alzheimer's, Parkinson's, right? Some of these are what they call lifestyle diseases. You make poor lifestyle choices, and as you go up, and as you go up as you get older, you start ripping what you had. So please, NCDs are coming. They're here. Let's be careful about that. Before I go on, I want to say something. This is from the bottom of my heart. I want you to listen very carefully, and thank you for somebody just dropped me a note. I was a pharmacy technician before I became a pharmacist. So I was a pharmacy technician. So I worked as a pharmacy technician while I was going to pharmacy school. Before I got into pharmacy school, then I became a pharmacy intern, which is not a technician, but I was. I understand. I am not in any way dissing or saying something negative about technicians. Technicians actually, one of the reasons why technicians are getting positions they're getting is because they get in touch with patients very early in their training, and they are trained, they are readier to deal with patients. So when I talk about the knowledge base, I am not in any way saying they're inferior. I am not saying they're superior. I am not saying pharmacists are superior or not. What I'm trying to say is we are a team in healthcare system, and the team in the healthcare system have different levels, just like my hands. If I show my hands like this, different fingers have got different length. This one is the ring finger. I don't know why they call it the ring finger. That's what it does. This is my thumb. This is my pinky. We are all different, but it forms a fist or forms a handshake. So all I'm saying is that we have different capabilities, and we can actually harness the capabilities and work together to ensuring patient outcomes are positive. So please, 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 I have absolutely good, I'm not here to throw stones. I'm here to say, let's creatively build the pharmacy. Because if we build the pharmacy, then outcomes are going to be better. If outcomes are better, UHC is going to be here. We'll be able to provide care for everybody else. Here's another statistic that I'm sure some of you have heard me talk about. In the US, the economic cost of medication errors is about $20 to $40 billion a year. If you do extrapolation to the Kenyan population, that's about $3 to $6 billion a year. It costs $6 billion in Kenya to run healthcare. That includes whatever comes from exchequer and the donors, $6 billion, which means if we take care of our medications the way we give medications to patients, just that could be enough to pay for healthcare. If that is true, how important is it to be in the pharmacy field, whatever the level it is, whether you're a pharmacy technician, a technologist, or whether you're a pharmacist? It's that important. Okay, so what I'm trying to say is, if we work together with our brothers and sisters and show them the knowledge we have, and we share with them, and we provide the care to the patient, that's what we're looking for. That's a creative opportunity. That's how to create opportunities for the future. Okay? I hope that's clear. Innovation. When I was talking about pharmacogenetics, so recently somebody very close to me went through surgery. I had a test that is called pharmacogenetics, which is where you take the genes. Normally what they do, they swab the inside of your cheek, and then they do the genetics and realize what enzymes your body produces or not. Those enzymes will be very important in drug metabolism and drug clearance from the system and other things. CYP450, right? You guys understand those things, cytochrome P450. So that genetic test really made a difference in the care of the person that I'm talking about. They were able to change anesthesia based on that test. Now, it's not here yet, but these are things that are coming. If you do chemotherapy, that's a thing that you have to change doses. So that's innovation. Please open your eyes, look and see what can you innovate? What are the new things that you can add to your care to the patient to see the difference, to make a difference? Because that's the idea. How do we make a difference? And pharmacogenetics is coming. But if we are still, if we don't read and keep ourselves abreast, all these new technologies will come and it'll just pass us and somebody else will take it over. So we want to be ready as pharmacists to make sure that we understand the therapy is ours. How do we create an opportunity to learn and provide the best we can? The last thing that I was going to talk about, actually, I think it's the last. Let me check and see. And if anyone has a question, please feel free to ask me. The last thing I was going to talk about is, how many of you understand how a lion pride works? The king lion, the king is the one who's the king. And for him to come out, what happens? There's always a lot of turmoil, and then people move and all these things, blah, blah, blah. Right now, the healthcare system is moving so fast. There's so much that's being done. It's literally like changing, like changing your wheel while the car is moving. You have to make sure that the car doesn't run over you. So far, I think the car's run over our feet a little bit. The wheel is on our feet. But how do we change that? How do we change that? We have to be positive. We have to show that we have what we have. Our character cannot be impugned. We have to understand, we have to show the knowledge we have. We have to show that we have empathy and good manners. We have to show that we keep time. We have to show that we do the things that are supposed to be done. We have to show that we're team players. We have to play. My goal at some point is to have the Ministry of Health have 40% pharmacists, because pharmacists are actually amazingly good managers. You know what you're doing, because the way we are taught, the school teaches you how to think. The thought process of a pharmacist, the way you move step by step, works so well in so many areas. What are we doing? What I mean by this is, I would like us to take over positions. Not take over because you've been put there, but because you've showed that you can actually perform. We at the Secretariat are trying to look for scholarships. We are looking for exchange programs. We are looking for many other ways so that you can boost your knowledge. We cannot know what you need unless you tell us. So one of the things that the Secretariat is doing, we are collecting data. How are we collecting this data? This is part of that turmoil to make sure that we have what it takes, the armor we need, so that if you're changing that wheel and the car is moving, even if it runs over you, it doesn't hurt you. So this is some of the armor. We're collecting data. We're collecting data on when did you finish school? Which school did you go to? Do you want to go for masters? Which masters? Which area of interest? What are you available to do? What do you want to do? We're trying to build a database so that when we get these opportunities coming in, all we have to do is get into a database, identify the top 10, and send them in. So make sure that you have your resume that's really clean and good. Another thing that many people don't do, when I was in school, it was part of a class, and you would fail that class if you didn't do it. We had to have a LinkedIn page, and they went through the LinkedIn page. The other thing, we had to bring our resumes. They had to go through the resumes. The other thing, we had to do an interview in class, and that was a class, and we passed before. You could not have finished pharmacy school without that. The Doctor of Pharmacy program required that. So I'm trying to tell you, the pride, we have to change. The leadership has to change. And how it changes is by you sharpening these things. Make sure that you are beyond reproach. Make sure that you are a professional. Make sure you don't look down upon people, right? Come on. Don't look down upon people. Make sure you share your knowledge. The knowledge you have, if you don't share it, you're going to die with it in your brain, and it doesn't help. Share the knowledge. We have our sisters and brothers who are technologists. Let's work with them. Let's learn from them, because they have access that we don't have. You're new in the field. They have been there for longer. Learn from them and share. Create a relationship where you share, you lean on each other. That is how you start changing the pride. You start looking, you be part of a solution, not a problem. Let's talk more with our actions than we are pharmacists. We need positions. Who cares? You can be a pharmacist all you want. Positions are not candy. You don't just dish them out. We want it to be that the people who run situations, people who are in counties, CECs and other people will say, we must have a pharmacist. There's a pharmacist in Kiambu level 5, level 6. She's working with the pediatric section. I have been in meetings together with her when the physician has called her, the doctor has called her to say, I can't prescribe this without you saying I should. How can you help me, right? That's what you want to be. You want to create a situation where you are such an integral part of care that nobody wants to move without you. How do you do that? Again, as I said, time. Make sure your time, you keep time. Make sure you do homework really, really well. Make sure your knowledge is on point. You have very good knowledge. Make sure you're creative in your solutions, including talking to my family members to understand who's the patient, where did this patient come from? What does she know that could help with solving this conundrum that you have right now? Please, what I'm saying is, let's be innovative, let's be creative, and we will be relied upon. I asked a question about the fishbone presentation of labs. There are some things that are unique. That one, the fishbone, I've not seen it being used yet too much, but it's a nice way of looking at all the labs in one spot. These are some of those tricks that you can get and see. And when you present yourself as a pharmacy student and intern, they look at you and they say, they want to be like you. Here's another thing. When you go to wherever you are, you have colleagues. You have physicians, the new guys who just left school. Try and form relationships with them such that they can tap into your knowledge and you can tap in theirs. I have some of my very good friends, people that I even communicate with right now, are people who are rotation together. They were doing surgery or they were doing their own cardiology rotations and I was doing mine. So they were residents. We used to go out, we'd sit down and pack a patient together, and we formed bonds that are really, I mean, I now live here, but some of them are in the US and they'll call me on some cases that I am miles away, but they still will call me and ask me, hey, what do you think about this, and that? Those are the relationships you want to form, lifelong relationships. Lastly, but not least, I am here for you. I am here as a resource. Those who I have taught in school, I've told them this and they know that. I've told them, I am here as a resource. I am not here to mark you down. I'm not here to pull you down. I'm here to build you up. So take this opportunity. Give me a call, talk to me, come see me, ask questions. I am happy to help you. And with those few remarks, congratulations again. Please let this be the generation that made pharmacy. So with those few remarks, I hand it back to Dr. Hezron Munyakin. Thank you, guys. Thanks for inviting me.
All right. Thank you so much, Dr. Lucas, for the insights that you've shared. I think for me, what has stood out is about creating opportunities. Wherever you go, make sure you build a good brand for yourself, because that is the only way that you'll channel yourself to greatness. And the other thing that you mentioned about the ring finger, which you said you didn't know why it was called the ring finger. So there's somewhere that I'd read, they were mentioning that in the ancient Roman, they used to say that it's the only finger that has a vein that connects directly to the heart. But then later it was demystified, but then they said it's not true. But that's what they used to believe. It's the only it's the only finger that has a vein connected to the heart. Yeah. Oh,
cool. So, thank you.
Welcome. So I see one question from Stacy. Any tips on how to navigate the workspace for non-traditional pharmacy careers?
Tips are many. The tips are many. As I said before, the guy put salt on the steak before he even tasted it, right? You go in and check and see. You know, you have to be confident in who you are and what you want to do. Okay. So I'll give you an example. All my students, I used to teach students, doctoral pharmacy students, and I had one of their homework was give me two to three places that you don't expect to see a pharmacy there. And that was a part of they had to do that to pass my classes. So one of them came to me and told me, this was the most interesting one. Told me, oh, NASA is hiring pharmacists. I said, why? He says, because there's more and more travel to space. And an ounce, if you carry 1 ounce in their spaceship, it costs thousands of dollars. So the question is, they don't need to carry medications they don't need. What happens when a patient is up there and they get sick? So what they were doing, they were working on a way to print these drugs when they're up there, if they need to print them. Amazing things. But anyways, that was a place, it's a non-traditional space for a pharmacist. So there are places that you could, non-traditional places where you can actually find a pharmacist. Now, there's one very good friend of mine, Dr. Ndemos' daughter. She's now working for Oracle as one of the innovation heads. And he was put there as a pharmacist also, as she's a pharmacist, a doctor of pharmacy too, and that's what she's doing. So a few things. One, make sure you understand the space you're in very well. If it's non-traditional, understand what makes it non-traditional. If you go to a soccer place and you're talking about rugby, they look at you like you're crazy, right? But you understand what they are first. So be a very good listener, be attentive to learn. Once you learn, try and identify. And even it's very nice now here, that's why you need a friend to say, hey, this is what I've heard and this is what I can do. What do you think? Get a third opinion and then create your path. You can create your path anywhere. You just have to understand, because there are gaps everywhere. Just need to understand this is a gap, this is how I can fill the gap, and this is how I can do it. And then you just walk into it. If you have anything specific about a space that you want, and you want us, Stacey, you want us to talk, I'm happy to talk to you about that. And I'm happy to I'll be available for you for that. But the key thing is, first of all, learn the space, learn it well enough. Ask yourself, what difference can you make? And be creative. Don't think about counting by 5 or, the silly things pharmacists do sometimes. You limit yourself to that little box. A lot of pharmacists want to go and work, and this is how our positions have been taken. You want to work in that pharmacy where you're giving kunywa moja mara mbili through the window. No, get out, see patients, go to the floor and see patients, talk to patients. Hey, how is this working for you? Is it helping you? Oh, one more thing. I forgot to say this when we were giving the talk. One of the questions I always ask the patient, any patient that I dealt with, is this medication working for you? If they said yes, I said, how do you know? If they said no, I asked them, how do you know? So then through that interaction, you'll understand whether this is effective or not, and whether you need to change it. And if I needed to change it, I'd call the physician and see how we can change that. So that's the same idea. The idea is, it's not traditional. You expect the doctor to tell you do this. Don't take that. Don't take that. The physician did pharmacology for a very short time. You have done pharmacology for 5 years. You understand these things. You are a better person to know which medication works. So when someone tells you, I'm a doctor, I've said, say, yes, I understand that. Here's the evidence that I have. That means you have to be confident in who you are, confident in the knowledge you have, confident in what you're saying. And you don't have to fight about it. Just say, hey, you know what? I agree with you. You're the physician here. Here's another layer of knowledge. When you do this and this, this is the outcome. And I think this patient fits best to do this and not this. And then you let them make their decision. They will fight you 2-3 times, and then they'll come down and say, you know what? You have something unique, because the outcomes are going to be there. So I don't know whether I answered the questions. If I didn't, let me know. I can give it another run.
All right. Thank you so much, Doc. So far we have that question alone, but
Sure.
I'm sure we might get some more. In case of that, we'll just let you know. So
sure. Thank you very much.
Thank you so much. Moving on, we're going to have okay, I'm seeing Cohen has just raised his hand. Cohen, do you have anything to say?
Yeah, I just wanted to say that I wanted to tell our interns that we have a gift that was given to us by Dr. Lucas, and we'll award it at the end of tomorrow's session. So probably we'll ask someone maybe a question or something. We'll see something that will deem it fit. So we have a very nice gift for you. So hanging there for the rest of today's session and tomorrow's session.
All right, thank you so much, Cohen, for that. So next we're going to have,
That's
Oh,
a
yes,
gift.
that's the gift, guys.
It's
The book
signed
on,
by the author. It's called The 5-Second Rule, and it's been signed by the author, Mel Robbins. You guys can go check and see who Mel Robbins is. It is a signed copy. You will not find this one anywhere else.
All right, thank you. So guys, hang on there. The gift will be given out tomorrow based on the questions that we're going to ask. So next, you're going to have a session on pre-internship MOH PPB documentation. And for this session, we're going to have two of our colleagues who will be sharing insights on that. We have Dr. Aden Siyat and Dr. Gad Lagat. So for now, I'll just open the floor to Dr. Aden. Dr. Aden, can you hear me?
Yes, please, I can hear you. You can hear me?
Yes, thank you.
Respected colleagues, senior colleague Dr. Nyabero, and I haven't met him still in physically. We've only been interacting virtually from Hopak to today, but hopefully I'll meet you physically soon. Dr. Cohen, Hezron, Gad, Patel, and our new interns. I believe you're all doing fine. And it's great pleasure to have you. Congratulations for being posted. And it's a transition time, quite tough. Sorry about that. Quite tough, quite a hard time, I know. And there are a lot of documentations, but Dr. Nyabero sold you a very good dream. I wish I relived internship again at MTRH, but unfortunately I can't. Time is not on my side. So to get to that dream, first you must sign a lot of contracts with the ministry and proper documentations. So in light of that, I wish to take you through that. And ladies and gentlemen, this is where you should. Hezron, please stop sharing so that I can share from my end. So ladies and gentlemen, here's where you shall be, looking for your even grandfathers, grandparents, marriage certificates. You shall be looking for, I don't know whose first driving license, but that was on a light note. That is a joke. Anyway, and you can see my screen.
Yes.
So, ladies and gentlemen, it's quite somehow tough, and these are not a few things that you can do without, because you must first sign with the ministry a contractual agreement on a temporary base that you shall be the extension pharmacist officer in the respective rotations that you shall be posted with, depending on whether you are in the industry, at a community pharmacy outlet, primary healthcare, or in a big hospital facility, wherever you will be traversing across the country. So in light of that, there has to be some procedural, things that have to be followed. And of the most important thing that you guys have to get is you're required to have certain documents. I said on a light note, you'll remember to get your grandparents' marriage certificate. That was a joke. These are the things that you need. First, you need an arrival letter. So what happens is tomorrow morning, whether it's tomorrow morning or whatever date, you shall be handed over your remind me the name. What was that document called? Your posting letter from the ministry. You shall pick it from, I don't exactly remember the office. It's been a year plus now. So when you pick that letter, it will say Dr. XYZ, blah, 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 in light of the internship posting as per the constitution, blah, 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 to be given basic salary. I don't know if there has been changes, but it remained around 42,000, if I still remember. For those of us in Agad, when you can remind me if I'm not saying the correct thing, but I remember it was around 42,000 that you've been posted. So you will be told you are given certain days. I don't know if there were 21 days or I don't know 14 days that you have to respond to that letter. That means that you have to either accept that you're taking the offer or you're you're declining to take the offer. So once you're given that letter, that is a legal contracture between you and the government, especially the Ministry of Health, to affirm that you are their officer wherever you will be placed. And to process your payment, your whatever posting it is, there has to be these documents that first you need to come and deposit with the Ministry of Health again before you embark on your duties, wherever it is. So first you need to get an arrival letter from either the hospital. I just captured the hospital because that looks a better, but I'll share the slashes, /industry /community, depending on which is your first rotation. By the MedSoup, if you come from KNH, MTRH, KUTRH, the CEOs. If you come from, so the highest authority in that hospital has to give you an arrival letter through the HR or whoever it is. And this letter is addressed to the PS Ministry of Health, and it has to be properly dated. Why is it properly dated? So your remuneration begins the day that you shall bring that arrival letter in light of its date. So, case in point, our lot was posted on December 21st. And so we were supposed to have begun our duties on 21st of December. But unfortunately, at that point in time, I was posted in Eldoret, and it was around Christmas time. So in light of me preparing myself to get to Eldoret and come back and collect the arrival letter, blah, 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 MTRH was closing down for Christmas in December 2021 on the 24th of December. So I was not able to physically be there. So I had to wait up until that of January 2022 to collect my arrival letter and drop it at the Ministry of Health. So later on, you shall realize there's something called a boom, which I believe all of you look forward to. So when my Kina colleagues Gad were getting, the accounts were quite shaking, I was left with quite a dent. But and that is not, it's not per se that you shall not be remunerated, but later also your contract begins on the 3rd of January. Mine began on the 3rd of January. It runs up until to 3rd of January 2022. So it should be properly dated in the sense that you get to that place the soonest you can be, and then collect your arrival letter. Number 2, you need to have these scan.
Aden, can I interject just before you continue?
Okay, please.
On the issue of arrival, in case you're posted, there are some facilities which are a bit flexible and others which are not. So for instance, if you're posted something like KNH, somewhere like MTRH or maybe KUTRH, all these referral hospitals, or even the mission ones like Tenwek, you cannot swap. Let's say, for instance, you posted at Mbagathi and you wanted to come to MTRH and you're given the arrival letter for Mbagathi by the Ministry of Health. When you come to MTRH, it will send you back to MOH to collect another letter, another posting order directly to MTRH so that you can be given the chance. Or else, I have a colleague, I think, Aden, you know him, mwenye alizungushwa na MOH. He came back and he lost almost 3 months in the process of trying to switch his hospital from Kajiado. I think I'm disclosing too much about the person, but yeah, from that particular hospital to MTRH. So when it comes to the first place where you are being posted, industry and community is a little bit flexible. You can comfortably switch to whichever, because all you just need is the letter from the board. But once you go to, if your starting point is the hospital, that is, especially the county ones might be a bit flexible and they might give you that arrival letter. But if you're posted to MTRH, KUTRH, JOST, or this other level 6 or referral hospitals, or even mission, I had mission guys also face the same problem. You might have a challenge. So you might have to reconsider whether you want to change or continue. Sorry about that.
Basically, the big hospitals can't accommodate, the whole 200 interns of you. at one point in time. Basically, that is the challenge that God is trying to pass around. Moving swiftly, I know watu wa Arsenali mnasherekea hapo, but we shall keep time. So you need to have a scan original documents of the following. Why scanned? Because as is the case with any government procedural documentations, there are a lot of times you will be told, you know, you need this, you need that. It's proper to have your ID, your KRA original, your KRA PIN, your birth certificate, certified copies by an advocate of your primary, secondary, university. That is, if by now you've graduated and you have your degree. If you don't, you should have your letters of completions, so that at least it shouldn't be an issue. And I don't think if they ask you for your transcripts, but I know they ask you for your university degree. And if not, you've graduated and your university degree is not yet out, you need to have at least a letter of completion showing that you have graduated or you've completed the duly expected courses and you are awaiting graduation. I hope that is understandable. So that at any point in time, wherever you are asked to produce this, produce that, produce this, the other thing that is very important, because what I know is many a times people just wake up and go to town. Photocopying in town, especially around Ministry of Health, is quite, if I still remember, because I don't think there is any shopping center around that. We had to go all the way to, of course, it's not that far, but it's quite a distance to the Milimani courts.
Or if they're willing to pay 50 shillings per page.
Yes, so you have to go to Milimani Court to get just a copy, man, which you used to get for two bob in your university cyber cafes and the rests, you know. So you better be planned with at least 2 copies of the following. But for issues of, you know, in case, just get an extra copy. So that again, you know, wherever you are being posted, like when we went to MTRH with Gad, we were also asked for copies of our IDs and then to ascertain that actually we are not in any way acting as an alibi to anyone, you know. So you need to get 2 copies at least of that. If you're a foreigner, by foreigner I mean you're not Kenyan by birth or by registration, and you don't have duly filled citizenship in this country. You're allowed to do internship in this country, but you need to have an internship pass from, I don't know if it's the PPB or that talks to the immigration and has to give you a working permit and a foreign ID for you. And for foreigners, sorry to say this, but there is no remuneration for you. It's a self-sponsored internship. That is what they called. So, and that does not mean you're a Kenyan, but you've studied outside the country. No, if you're a Kenyan studied outside, you will be remunerated. But if you're not a Kenyan citizen by certification, by birth, or by naturalization, I think those are the 3 main, then you're not Kenyan. I mean, you are not remunerated for your internship. Number 5, you need to have at least 2 recent passports, but for purposes of many other, you know, duly filling, you know, certification, I mean documentations, you need to have at least 4. But at the behind your 2 recent passport certificates, you need to have your ID number and signed. That is in case that passport copy is detached from your documents, can be traced to you. And also for purposes of uploading it into the ministries, you know, portfolios and whatever it is. Here it's where it gets better. For all of you, you understand that there has to be, I mean, as long as you're a government officer, you need to have an NSSF card, an NHIF card, because as an officer, you're required, the state is responsible for covering your healthcare. And then your NHIF really comes in handy a lot of times, especially now that you will be upgraded to a civil servants package, where you can be able to access healthcare from any point. And what you need to do is have an NHIF card. And if you don't have an NHIF card and you're around Nairobi, and you can go to the Huduma centers, If not, you could go to the satellite NHIFs in different, hospitals. And in Westlands, I know in Rainbow Tower, that was the least traffic then during our time, which a few of our colleagues had suggested in our groups. In Rainbow Tower, there is both NSSF, I don't know, in second floor, an NHIF in that floor. So you can get everything duly done for you, and your biometrics and everything will be taken there. So you need to have an NHIF and an NSSF. Number 7, and I believe you all need to be remunerated. You all need to be given your duly earned coins, and it takes a while to wait for this money, man. But I had the last two batch behind us. They were given their remuneration in the second month of that month. Kuna hako ka utamu ya kungoja boom, bado kuna ka uchungu yake. So you need to have your duly filled banks, and come with your signed and stamped copy of your ATM or banker's card. For the list of banks that you need, you're not supposed to use any bank. There are 5 main banks, and the 5 main banks are: number 1, KCB. They are down there in my documents. KCB, Cooperative, ABSA, and Equity. Yeah, I think those were the 5. If you don't have any of those, please get yourself an account tomorrow or the soonest you can get from any of the banks. For purposes of efficiencies, different banks have different advantages and disadvantages, and I don't want to give details on which bank is good and which is not. I believe that would be your homework or your discussion among your colleagues, so that you can be able to guide yourselves amongst yourselves. So you need to get a bank account, and you need to get your copy of an ATM immediately. But a wise financial decision, I will tell you, have at least 2 bank accounts, so that in case one is not working and you are in an emergency situation, you can have a backup with another bank account. But at MOH, you are not supposed to submit 2 bank accounts. You're supposed to submit only 1. So depending on the one that you choose to submit, please equate a safe, secure account that is not, in any way associated with fraudulent or anything whatsoever that would, affect your finances at any point in time, so that you don't cry foul that, your money has been stolen or whatsoever. So just be secure in terms of your finances. And so where do you have to get the copy of your ATM or banker's account? For purposes of financial securities, your ATM is actually not supposed to be copied. Especially, I don't know if any of you has an ATM card. Behind there is something called the CVV number. If I have an access to your CVV number and have an access to your account number, your bank number, your card number, I can transact with that card even without you knowing. I'll just log in with any shopping, So what I'm trying to tell you is, please get these copies at your bank branches. So, case in point, your bank branch is somewhere in, for example, let's say your bank branch is somewhere like, and I'm thinking of bank branches that I could know. Let's say in KCB, no, let's just use commercial KCB. That's where your bank branch is. So when you're filling hapo kwa hiyo, that's where your bank branch is, and that bank branch has a code number. So you must also ask for those nitty-gritties with the bank managers and whoever is serving you, the relationship manager or whoever is serving you. And then you need to get that copy from them, and it is supposed to be stamped and signed with the official bank, stamp. Why am I telling you get these copies from, from that bank branch? Because banks have invested heavily in security of your personal information and your card numbers. It's least possible to attack. Among many other cases that, there have been banks that have been attacked, online hackers and anything. But it will be worth having your copy with a photocopy outlet anywhere else. You don't know who's going to steal your CVV number and whatever it is. So please keep your card numbers intact. And whenever, if you've lost it before, I hope you deactivated it. It's time to go get another one. Different banks charge different charges to acquire the bank account, to acquire the ATM card. So if you're opening the account newly, you will be asked to, depending on how much that bank charges for the ATM card, you must have that amount in your account. For others, they need a minimum deposit, whether it's 2,000, 3,000. So you just plan yourself with around 3,000 or 2,000 in your pocket so that it can be able to help you get all of that. There's something called GP25 form. And here you must fill, that is number 8. Here you must fill your two next of kin.
Just a minute.
Yes, please.
Yes, somebody asked on the GP7 form, indicating the basically signed and stamped. So basically what it means, signed and stamped, you have the bank itself will sign and stamp it. And let's say for my case, even the photocopy which I printed, it had to be signed and stamped. That's of the card or the banker's card or the ATM. Though you don't have to print the back side of the card, but it has to be signed and stamped. You just can't photocopy and take it that way. I think I've addressed whoever that was.
Thank you for the input. So we first move to GP25 form, here where you fill your two next of kins. I believe we live in a dynamic society, and as a human being, you're vulnerable to anything. You could be sick, you could be charged with certain security cases, you could be, whatever happens, you have to be traced. You have to be gotten wherever you are. If tomorrow, in God forbid, in your line of duty, you get an accident, at least the ministry has to tell this information to your next of kin and tell them that so and so, who was our extension officer, wherever it is, has gotten XYZ. So this is for purposes of your safety. You need to have two next of kin, necessarily not for purposes of security concerns, but the people whom you believe, and are readily available, always available, and whenever they are told about your name, they'll be concerned. And your parents, I believe, should be, or at least one of your siblings. There's something called Secrets Act, signed and stamped by an advocate. Here you declare that you, as a Kenyan citizen, shall not declare the secrets of the state. Hautasema shamba za serikali ziko wapi? On a light note, I'm joking. So usually, it's a long list of, I don't know how many pages, I don't remember, around 9 or 8 pages. Please, and please again, please, I beg you, read thoroughly through that document, so that tomorrow, if you are arraigned in court for purposes of, treason or whatever it is that you have not been able to justifiably align with the rules of the land, then you don't say, I didn't know. Ignorance is no defense. So don't just take it to a lawyer to sign for you. Read through it thoroughly. Read through it thoroughly, so that tomorrow when you go there, you know what were your obligations as a citizen of this country. An extension officer of the Ministry of Health, that you did not declare any secrets of this state. Number 10, you need to have a medical certificate, which is called GP69. This certificate has to be filled in duplicates. So when you're printing, I believe these forms will be provided in your respective groups. Zitatumwa hapo. So when you are supposed to download and print the GP69, print them in duplicates and let them be signed and stamped by a registered medical officer from any government facility. Sawa. If you're in Nairobi, I'm sorry, it's sorry to say this, but the people who charge for this, Mbagathi charges around 700 shillings. But if you know one of your friends who's an MO in whatever facility it is in this country, just fill them and let him sign for you. And number 11, remember the story I told you up there, that once you're given that letter, you have to accept. And by accepting that letter, you have to write a handwritten letter of acceptance or typed that is addressed to the PS Ministry of Health with the reference number of your posting letter. Hapo juu on your posting letter itakuwa na reference number. You say that I, XYZ, have accepted to take this internship opportunity, and you say that you have read the, the different, what is expected of you, and you're duly thankful for the opportunity that you've been granted, and you will serve this country in whatever capacity you're called. Short, precise, and to the point. You need to get a copy of your original letter of offer, which you've been given. So you need to have two. The copy. So remember the posting letter that you'll be given at the ministry whenever you go to pick your posting letter. So that is your original contracture between you and the government. Please keep that original letter so that in the future, if you're told anything, with the dynamics of life, man, anything can happen. Keep your original letter, get a copy, preferably a colored copy of that, attach it with the documents. They will be in a manner that you're supposed to attach it. So you keep one, come with the other. Anytime you're requested to give it anywhere else, also give a copy, have extra copies around 2 or 3. Like MTRH also expected us to come with a copy of that posting letter. So you need to have that extra. So depending on wherever you go, you're supposed to have that letter. The Public Service Commission Form 2, which PSC2 form is in the Public Service website. So you need to fill the PSC2, not the PSC2A. Please remember that. So I believe you will be guided. I cannot show it right now from my PC here, but you will be guided. So once you present all of these documents, just scan them again. I believe all of you have phones. Phones these days have, inbuilt scans, apps. Just scan them and so that you can keep them in the future. So that in case anything is needed, because at times what happens, there are colleagues of ours who aren't paid because they were told by the 5th month, these guys weren't paid because they were told that they are not in the database. So they had to locate the original offer letter, blah, 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 get everything. And whoever was at the ministry was quite compassionate, and they're like, we're sorry this happened, but you will be duly remunerated and reimbursed for whatever services you've provided to this country. So please keep these documents. Number 2, keep your arrival letter as a pharmacist again. So copy of your arrival letter again has to be uploaded in the PPB portal, your respective portal. And then you must keep it. So wherever rotation you are in, you must keep that arrival letter. Keep the physical copies and the scanned copies. Upload one for the different rotations in your portal. I think that is clear and concise. These are just special considerations, which I believe that if you don't have any of your certificates, at times life happens. You might have had, some fire in your home and you lost your certificates. It happened to one of my close friends whom we were together at MTRH. He lost his certificates, but he had to go to NEC offices in South B. You can also go to NEC offices in Dennis Pritt Road, along State House Road, around State House area, whereby you will be given your original certificates. I don't know after a certain period, but you'll have to pay a fee of around 5,000. I don't know if Yes, please.
Regarding that, actually the friend you're talking about is me. I lost my certificates and my KCSE certificate, to be specific, and I had to go replace. It takes around 2 weeks to a month. And given the time frame which you have right now, it's not possible to have who manage to present that certificate, the replaced one that is. So depending on who you'll find there, I talked to Gishira. Some of you know Gishira, the people what when you interact in MOH. He told me I can print the receipts from NEC. That is the M-Pesa message and the receipt which you're given at NEC for that replacement, number 1. And number 2, you can write a commitment letter actually for me, I wrote a commitment letter, which was just a handwritten draft committing that you will
bring
you'll bring your certificate within a month, or else the commitment now is a bit heavy, or else you won't be paid. So if you fail to bring it, they won't give you a salary because they'll feel you're an imposter. So that is a bit on the higher side, but just print your certificates and write a commitment letter that can be used as a substitute.
Number 2, another special consideration. Thank you, Gad. If your ID name doesn't match the names on your certificates, I believe at times we go through a lot of transformations, and at times we don't like names, or mistakes happen when you're registering in whatever or for whatever document, your passports, your IDs, your birth certificates. And if it happens that your names don't match on either of your certificates vis-a-vis your ID, please come with a duly filled affidavit whereby you're indicating the reasons as to why the names are different, and give the details and the nitty-gritties on what happened in the presence of a lawyer. It's not for you to scratch your head. Lawyers are better, they craft this letter better. So you just look for a close confidant in a lawyer whom you know, and then so that they can be able to help you through this. If the dates on your birth also don't coincide with those on your birth certificate, you also need to show an affidavit, so that we don't know if you just woke up from coma, or I don't know, when you're registering for your birth certificates, something happened. You just give your narrative and be true about it, so that it doesn't bring you any issues in the future. And you'll also have to fill an affidavit indicating the dates on the birth certificates is your true date and not that on ID, because at times what happens is when the entry person at the ID registration erroneously enters different details as opposed to the ones on the birth certificate, it becomes quite an issue. It hadn't been on you, but maybe you got an abstract to show that, you got an affidavit to show that that happened. Then you need to, if you lost your ID and it's still in the process, which I haven't captured here, please get an abstract from the police to show that you lost your ID and you presented yourself to police stations in this country and you got this, and you are waiting for your ID to be, to be duly processed. As I told you before, these are the bank accounts that are accepted: the Kenya Commercial Bank, KCB, the Cooperative Bank, Equity, ABSA. Those are the only ones that are accepted. If you don't have any of those, please get yourself one. And if you do, go search for your bank accounts. Please remember, for every certificate copy, you need to have an original stamp, verification stamp. I don't know if it's from the chief or something like that, but I think it's also from a lawyer. And then you need to have no photocopy of them. If you are told, actually what you will be told is bring your original certificates vis-a-vis copies, so that they can. Gad, you remember that lady in room 1 something that was on the left? I don't know which floor that was, but it was somewhere that other
First
side.
floor.
Yes.
Room 114.
Yes. So she counter checks your original certificate degree vis-a-vis the copy, your original birth certificate vis-a-vis. So when you go there, please don't lose your documents. A few of our colleagues lost their documents that day in the process of heckling around. It's quite tedious a process, I can tell you. Please, you need to, at least in groups, carry your bags, and so that if carry a bag or something that can help you keep your documents safe. At times, one of my colleagues lost everything. He had to get new ID, and he just had submitted everything, thankfully. So please don't lose your original certificates, and no photocopies will be allowed. Sawa. I think that is from my end. That is the Pandora box from my end. If anyone has a question, please, and I think that is it. That is that. Thank you, Hez.
Maybe Aden, before you go,
Yeah.
help me answer these questions. Like there is one who was mwenye ameuliza regarding names not matching. If a birth certificate has 2 names, while the ID has 3, is that still a matching issue? Like, for example, my case, my birth certificate has 2, and my ID has 3. But I didn't get any trouble, but I had some colleagues who had trouble. So I don't know, what is your take on that specifically?
It's a unique case because in our time I haven't met, because you remember we used to discuss these issues on our group. It's a unique case. I haven't met anyone with such a challenge, but I would suggest you try your luck. Just drop the documents, and if you're asked, you can be able to
get the
handle
affidavit,
that
because affidavits are
situation.
very expensive.
Aden,
Yeah,
I'm saying that 2 people have raised their hands, Anushri and Cohen. Maybe I don't know if they have anything to comment on that.
please
Yeah.
let me.
Regarding the affidavit, when you have different names, what you can do is you can approach a lawyer and tell them that these are the names on your documents. Let's say, because I had that issue where on my birth certificate, my name is pretty long, and based on my other documents, I was using an abbreviation of it because that's actually what I'm called. So I had the lawyer list down all the names on all my documents that I'm identified as, and it states that this name and this name, they're actually the same person. So that is one thing you can do. Like, for instance, I think my degree has Dr. Anushri Patel, whereas my full name on my ID is Dr. Anushri Girishpai Patel. So I was missing my middle name, and I'd put all those names down, have it signed, and I think you have to have it notarized or something of the sort. But if you have that list, it should be helpful. So you can even present a copy and be like, hey, as much as they differ, I do have an affidavit that states that all of this names are the same. I hope that helps.
Thank you, Doc, for the input. That helps. I believe I wasn't able to go through the chats before, but
I went through the chats for Aden. No, for Cohen. Is Cohen still in?
Yeah. So on that
about
issue,
just a minute.
sorry.
About changing internship centers. What if you have someone to swap with? Is it still complicated? Can you answer that on behalf of Robert Ambogo?
it is not. Actually, that was what was advisable. Let me tell you what happens in those days, because man, I don't know if I should laugh out of laughter or out of pain, because we had to camp at PPB's office for 3 days. It was that sad. I'm not in any way regarding PPB to be inefficient, but it was people desiring to go wherever they want to go for whatever reasons it is. I mean, there were valid reasons. At times, there were not so valid reasons, because there are people whom, they had families and they did not feel, you are in Nairobi and you are thrown somewhere in Muranga or Eldoret and you don't want to. So what happens is, actually what PBB requested was that it is easier to swap facilities with someone you have. Case in point, a friend of mine was posted in Mathare. Another friend was posted at MTRH. PPB, so out of interactions in the group and people talking when people are camping at PPB, the person who was posted at MTRH did not want to go to Eldoret because she was about to deliver. The person posted in Mathare did not want to go to Mathare because they wanted to go back home in Eldoret because they also had a family. So PPB was able to sort that, and actually that was what they were advising. As long as you have someone to swap with, it's much easier, but you can't go ahead with that. The procedure is like this. You need to go to the PPB offices and declare that you want to swap for certain reasons. PPB writes a letter for both of you, which you now take to the Ministry of Health. Ministry of Health has to effect that letter from PPB from their posting order to show that, also for purposes of remuneration. Someone in Eldoret is not paid the same as someone in Nairobi. A few shillings off Nairobi is higher. So Ministry of Health has to effect those changes from their end and show that Dr. XYZ has swapped from Eldoret to Nairobi for reasons XYZ. And Dr. ZYX has gone from Nairobi to Eldoret for reasons XYZ. So that was what happens. I hope I've answered it well, Gad.
Yes, I think you've answered it well. And there is somebody who was inquiring about arrival letters. And just to answer you, let me just go back. Although I've answered you in the chat, the arrival letter will be given once you may report at the site. You can't have your arrival letter before you go to the hospital and you're posted. So the first thing which you need to look out for is your posting order. Is your name on the posting order? Since you mentioned that you did your exams a month ago, so in case you will be in the posting order, because in our instance, some names, almost around 40 names from University of Nairobi missed in the posting order, and they had to be posted almost 6 months later. That was just a discrepancy, but I hope it won't happen to you guys. But if you're in the posting order, the moment you report to wherever it is, whether it's the industry, community, or hospital, you'll be issued with an arrival letter. So don't you worry about that.
Would you kindly drop your contact so that we can easily reach out to when urgent need arises, please? We've created a group for, I believe some of you, we've interacted before from inducting you when you are doing for the exams. There's a group created in the PPB stage 1 group, and that is where you could get us. That is where the link is shared. I believe there are some of you who are here. Please share that link so that we can guide you. We can't individually help each one of you, but we can at least help you all in regards to how the question comes. So please, that is where you can get us. David Rob Kipto.
And for those missing the Secrets Act, it will be shared in your group likewise. So don't worry about that. If you miss any document, just post in the group. I'm sure Cohen is in the group, and Kina Hezron. They'll post all the documents, whatever you're missing. Even your colleagues can share with you.
Diana Kiete is asking a question. Can you change the order of internship areas? For example, you want to start with industry instead of hospital. So you can, Diana, but I believe you would want to save yourself the headache.
Exactly.
Because one thing I'll tell you is PPB that day, for whatever reasons, you'll never meet anyone in the office. It's that time of the year where you will know no one is around. But you might
actually lose a month just messing up with that change.
Just because someone is not there, because you just want to change out of your own reasons, your valid reasons from industry to hospital. But the thing is, these effects, there was a reason as to why PPB had already placed you there. I will just advise you guys, man, just out of faith, accept wherever you are posted, because you all can't go wherever you want to go. You all can't have the orders in the manner you want to have. Because it's quite tough for PPB to, it's like telling them, man, we need our way, not your way, and it's quite tough. But if you have your reasons to change, and you meet a compromising, compassionate person at the offices in that day, if they are able and willing to help you, the procedure is like this. They shift that, so again, remember, most industries are in Nairobi, most hospitals are outside Nairobi. So your stay in Nairobi affects your pay, and your stay outside Nairobi equally affects your pay. So whatever you first start with, that is the first, remuneration you get for. So if you start with an industry, you'll be locked with the Nairobi pay. If case in point, you start in Eldoret like me, you'll finish with, wherever you began with the pay. So what happens is the same case as I told you with the person swapping. PPB has to write again a new order just for you conclusively. You take that order to MOH. MOH has to affect that. Let me tell you, what happens is MOH can even take 3 weeks to just effect that change. And you will waste a lot of time waiting for arrival letter. I mean, it's not a hassle you really want to go through, and I will just encourage you, take it as it comes. I'm not saying you suggest you settle for mediocrity, but please, also PPB understanding, because what happens is you will be posted in some industries which aren't accepting interns. Case fact, GSK was not, but right now it has closed. Other industries aren't also accepting, it's one of the things I would request Dr. Nyabero if he's still in the chat. Those are the kinds of things we need to streamline if we need to have, a better vision in terms of the technicalities around training of the pharmacy profession, doc. Because I believe PPB as a regulator has its own reasons as to why it gave the social responsibility of that individual industry to train these young pharmacists for them. And it's such a, ingratitude from the industries to not accept to train an intern who out of his own volition and innocence and his own pocket comes to the industry to ask you for a placement and then you lock them out. Those are the kinds of things they are supposed to be streamlined. So there are industries that you will first arrive at and they don't accept. There are communities that don't want interns. What happens? Honestly, you ask them to write you a rejection letter and you take that rejection letter to the PPB and you will be, advised on how to vary your places of, your
Actually, the easier way out, Aden, the easier way out is just to go online. Even they'll tell you verbally before they even once you're posted there by the board and you go to this community, some of them they're like, oh, by the way, we need to talk to the board first before we take you in. That will take a month. So in such a case, you just go online, do a site variation. The rejection letter might or might not help, but do a site variation and you'll get another letter. Even if you still have the first letter, you'll get a second letter to whichever place. And me and Aden, we had challenges, especially with the industries. We had to kutembea from industry to industry kuuliza, hey, mnachukua watu.
Six industries in one day, and you've just relocated from Eldoret.
So you can imagine.
You can imagine. So what I'm trying to tell you is, gentlemen, here is where you will learn, ladies, here is where you will learn what it means to be aggressive as a young pharmacist in this country. Don't settle for mediocrity with the HR teams to tell you, we will call you back in 2 weeks. That's your time wasted. Remember, those 2 weeks have to be recouped again, and you're the one paying for that time when your friends have finished internship. So just tell them clear outright, am I having a position here or we are done?
Yeah.
And if they tell you we're done, you're losing nothing, man. Just pick your letter, rejection letter, take it to PPB and apply for variation on the portal. It's simple.
And actually it gets easier, especially with the first one is the hardest to change, especially if you are posted in hospital. Swapping just at the beginning right now might be a bit tricky, but with the subsequent places you're being posted, it gets easier, such that the industry and community, those ones you'll just go to the portal, change to whichever. You can even just talk to, I know most of you had locums before. If you're superintended by a pharmacist, you can talk to your previous employer, umwambie zile za, oh, by the like, can I come back here? And if he's okay with it, it's easier by far.
Those are the benefits of networking you will learn. I believe that is not my topic of discussion tonight. Fast forward to Sharon's question. Are we going to get the arrival letters for all the 3 centers immediately? Sharon, no, you are not getting. It's one arrival letter per every destination or rotation you arrive. You get to the hospital, get the arrival letter, complete, get the completion letter. Go to the industry, get the arrival letter, complete, completion letter. Primary healthcare, complete, completion letter, and then all that. That's how it goes along. So
Aden,
it's all one at a time.
Aden, there's something I think I don't know if you've mentioned, but
yes,
there's that letter that we get from PPB that you select the location that you're supposed to go. For example, if it's an industry, for example, if it's Cosmos, you're supposed to go to the PPB portal, then select the facility that you've been posted to. Then it will generate a letter that is addressed to the facility that you're going to. But I don't know if you talked about it. Maybe you can give clarification on that.
Okay, so here is the thing. So tomorrow morning you get your posting letter. You're posted to go for your hospital rotation at KNH. So before you go to KNH need to have a proof that you've been sent from the PPB to be one of their interns. So you fill in for an internship posting in your portal. through your portal, whereby you will be generated an online posting a letter to that respective, like it is addressed to the chief pharmacist KNH, that Dr. XYZ has been posted in your facility for duration from today on 15th of January to 6 months, 15th of June or July, wherever it is. And it's clear, it addresses. So using that letter, now the HR will be able to generate an arrival letter for you. So you get your letter, you can't have your arrival letter before you putting, first of all, keying in through your portal where you are going and PPB immediately. At times it takes some time, but you will be notified when their system hitch-ups, and then you will be told that the systems are down or holidays when they are not working, and PPB will immediately approve your letters from their end. And then you get your letter electronically, print it out, take it to the HR or whoever you are supposed to report to, and they can be able to generate an arrival letter for you. That is what Hezron has reminded me.
And the other thing is sometimes it might take even up to a week for you to get that letter approved after you that's after you apply on the portal.
That's the aggression I'm asking you guys from. At times, whoever is behind that computer is overburdened or is not in the office, and you're wasting your time to get that letter. Work yourself in a group, or if you want to be individually, go to the PPB offices and demand, not ask, demand that you be approved. Please don't shy away from fighting for your rights. I'm not in any way causing any aggression in this. I'm not in any way asking anyone to be aggressive in a bad manner, but in a respectful manner. Muniru City, where do you get the GP7, 25, and 69? They will be provided. You will be finding them in your respective groups. Morizo Murwa, unlike previous years, the areas of rotation are not known to us until now. Does the posting order indicate the areas? Yes, it clearly indicates that you're going from hospital to PHC, to community, to industry, or industry, community, hospital, PHC, or you will be given, but there are 4 rotations, majorly hospital rotation, industrial rotation, community rotation, or PHC. So there's something called, you could either go for industry or a program like NASCOP, national something what. So you'll be advised on that as well by PPB. I don't have exactly the reasons. Kindly share the group links, they will be shared, please. How will we know we are supposed to pick posting letters, and how do you get emails from MOH and PPB?
That's why someone has to go.
Ngoja. The sad reality is, case in point, we were asked to pick our arrival letters on 20th at 9 p.m. expected to be reporting to our respective destinations on 21st at 8 a.m. That is the miscommunication. So Bibiana McKenna,
that group has they have a representative. The problem with this lot of pharmacists, I'm sorry to say this, but I've been following up with the issue of internship posting, and we've been having representative from MOH, from the MBCHB, dental. Like for my year, I was one of the representatives, and I was actually, you need to get somebody friendly within MOH, as hard as it may sound, so that atakuhint zile za, oh, by the way, your letters are ready, mkujie. Or else you wouldn't find it. MOH will never call everybody at Kwambia, or by the way, come for your letters. They wouldn't do that.
Expect no email from PPB unless they're asking you to pay 10,000 for your licenses or for the exam. It's the sad reality of MOH. So please be proactive, and then a few of you could sacrifice themselves and go to the MOH to confirm and ascertain if there is any. Which portal is this, and how?
Then you remember during the D-Day tulipiga cambio MOH. You guys need to show up. Like
which there's someone called Happy. Happy, I don't know if I'm to make you sad, but if you don't have a portal up to now, have you done the stage 1? I believe all of you were given a portal.
Some people don't do stage 1, Aden.
Haya. Hata wenye hawajafanya stage 1, Gad.
Yes, for us, ukiwa fourth year, I'm guessing happy ulikuwa UN, right? Okay, I don't know. You can't reply, but yeah, I'm just guessing you're in UN. So when tulikuwa fourth year, tulikuwa registered, tukapewa those index numbers in our emails. So just go to your email and type PPB kwa search box. You'll get the latest email. Now, one of those emails iko na link ya kwenda kuregister kwa portal. So
And
once you register kwa portal, you go to the internship tab, and then from the internship tab, then you can find the rest.
That portal is your life from here on. That's where you access your stage 2 exams, results, notifications by the board, licenses, renewals, whatever it is, please. So please, whoever doesn't have that, get that. I believe that is the end of the questions. I hope I've been helpful to at least elevate and
So Aden,
give you a better understanding of whatever is expected of you. Thank
there
you.
is one more question in the Q&A where somebody asked, what is the first progress to begin when the posting is out? So the first thing, everybody, you have to go to Nairobi to MOH to pick your letter. Once you pick your letter, you go to wherever you are posted, kwenda kuchukua the arrival letter na basically to report. Once you report, to give them your letter of offer and your posting letter. In return, they'll give you back an arrival letter. That's what, together with all the other documents, you need to bring it back to MOH within 2 weeks. And you have to report back to wherever you're posted within the time walikupea. Kama for us, I think Aden tuliambiwa tukuja after 2 weeks, 1.5 weeks. I think somewhere around there. So,
yeah.
And number 2, is there a deadline to pick posting letters? Like tomorrow? No, there is no deadline. But the earlier, the better. You know, once, in case wakiwambia mkuje those letters tomorrow, try at least tomorrow or the day after tomorrow, because this MOH guys watenda shughuli zingine. By the time wanza kutrace sana your posting letter, ni madrama mingi. So in case wakisema it's tomorrow, just try either tomorrow or the day after tomorrow, uondokea wasi, because they have a lot handling. They're handling a lot in their hands. I think that is all.
All right, guys, I think maybe we could just respond the last one, the question by Gesari. I think that was the first question that also came in. Then I think we'll just close with that, because we'll have this session again tomorrow, but then we'll be touching on other things. So maybe we could continue with this tomorrow, because I'm seeing time is really running out. So maybe Gad or Aden could just respond to Gesari quickly.
Aden, maybe?
Can you repeat NHIF and NSSF section? So if I remember well, what I said is that if you don't have an NHIF or NSSF, you need to get yourself one. That is a must, because so if you remember originally, NHIF used to give out a card. So if you have that card, you're expected to have a photocopy of that card. But of late, NHIF does not provide a card. So whatever offices you will register, tell them to fill out for you a certain form that they fill that indicates your NHIF number.
Card.
Pardon?
It's actually called a temporary card. Tell them to give you a temporary card.
Yes, so that they duly fill for you that, but don't give out that card. Give a photocopy of that card. You know what I mean? Like that card could be for your future references, you yourself as an individual. So just make a copy of that, and then you give out that copy that indicates your ID number, your NHIF number, and then you know that. Number 2, you will be asked at NHIF, what do? You tell them you're a civil servant at the Ministry of Health. It's advisable to just Google I think they will ask you for the box office of your employer, which is MOH. It's indicated in the internet, and a few other details. They need your copy of your ID, and you need to pay a activation fee of around, I think, 500 shillings you need to pay. So in a nutshell, copying bank accounts, NHIF, NSSF, nini, you just have some cushion, man, some small cash in your pockets or your M-Pesa. In NSSF section, it's also mandatory to have one, because it's one of the deductions made for you. So I don't know how much NSSF was, but I think and I believe it's 200 shillings. So you need to.
Yes, it was 200.
Yes, so you need to you need to prepare and plan for that as well. So they will duly instruct you on how to fill the forms, and you know what to expect. NSSF gives you a card, I believe, but if they don't, I think most of the operations are now being shifted to e-operations, that is in electronic operations. So if they don't, just ask them to give you a printout card, which actually they do, I remember now. And once they give you that, ask them to laminate that card for you, and then get a copy of that card and attach those copies to your document. Where can you get these services? All Huduma outlets, you know, all what is it called? Huduma outlets, NHIF satellites, NSSF satellites. But preferably, I'll prefer NHIF. I'll prefer the Huduma outlets because they were quite efficient and timely in the manner in which they were able to sort many of our friends that time. So I think that is it from my end, unless anything to be added on, please.
And then another question of, will we apply for internship license?
None. I don't think you do.
Unless you're a
I think that
foreigner.
one is only for, if it's there, maybe it's for MOs, but you won't need any license.
You don't need any license unless you're an MO, Nyakerario. Sorry if I'm mispronouncing your name, but I believe that is it. You don't need an internship license as a pharmacist intern. All that is expected from you is just to have that letter from MOH, I think, nothing else. For licenses, you will just be able to you will be able to get them after doing your stage 2 exams, I believe, which will be once you are done with your internship rotations.
Okay. Thank you so much, Dr. Aden, Dr. Gad, and also Dr. Anushi and Cohen for the contributions there. I remember during our time, I think having a common group and like doing things in as a group, it really assisted us a lot, because ukifanya peke yako, I'm telling you, you will suffer. So at least have a team that you always go around together to do these things together. At least itakuwa easier for you, because that's where at least you'll get contacts of lawyers where you can share contacts and such kind of things. Thank you so much. So tomorrow we're going to have another session. So if you have any other questions, please just keep them for tomorrow, and please join. Remember, there's still that reward from our CEO, Dr. Lucas. So remember to join. Yeah.
Last thing before we finish, please. So Gad alluded to something very important. And okay, I know maybe we have some MOs intern here, maybe some dentists, and also pharmacists. What I want to tell you guys, you see, for us, our generation, the challenges we face are so different from the guys who came before us. So like tomorrow, your letters are supposed to be there. Please, no one is going to push this thing for you. The way you guys are, just have a contact at the Ministry of Health who will even give you information that letters are out. If your letters are not out tomorrow, if Dr. Davji calls for 100 people to show up, please show up there. I remember last time they called for interns to come in solidarity, only 3 people came. So if 3 people out of 300 show up, you know, they'll even think the rest of the 290 or the rest of the 1,000, including dentists and MOs, you don't want to get something done. So no one is coming to save you. So for this, man, just show up, be proactive from tomorrow. If your letters don't come out when KMPDU calls, if 500 of you show up at the ministry, trust you me, your letters are probably going to be fastened. But if you play it soft, nothing is going to happen. It's not supposed to be that way, but unfortunately, that's how the situation is. And then lastly, I know we'll talk about it tomorrow, but please join PSK. You're going to be paid so much money. To become an associate member of PSK is only 5,000, only 10,000 per year. But the kind of social capital you're going to get from this is priceless. After you finish your internship is when you'll know the importance of having, you know, networks in the association and all that. So yeah, that's it for me. Thank you, Hez.
All right, thank you, Cohen. I'll just give a few minutes to Dr. Lucas to make his closing remarks. Then we'll have Dr. Anushri to close for us. So Dr. Lucas.
Yeah, and this is amazing. I must admit mine was not this complicated. We were our things were a little different. So there are a few things that those people who've gone to industry and then their industry, maybe they not accept, or they're not aware of what needs to be done. So we are working on a few things here and there to make sure that rotations, or rather internships, make sense and they're sensible. Some people have gone to rotate to internship where they are on the phone calling customers for their, things that have nothing to do with pharmacy. So that is being streamlined slowly but surely. We are also going to be asking for data. So for example, we'll set up a section where whatever you do, if you do anything, papers, you did presentations and stuff like that, we start collecting that. You saved a company, something they were doing, you were at Good Life, and there's a patient who was having this medication interactions, you got involved and that changed. Please record those things. If you send that to us, we develop a portfolio of saying, here is the effect of having an intern in your facility. People don't argue with data, and people don't argue with data that shows that they got better. So that's what we will try to do. So we might just reach out to say, hey, here's data, send it to us. We'll have a folder where you can put it there. And then we will use that to try and make sure those who come behind you really get a better experience. That data can also be used to present, to show what you've learned since you went into internships too. Okay, so as in terms of things that when you go to industry and you have an issue, reach out to us and we'll reach out to FPPB and see how we can help with that. We have the team here led by Dr. Andove, and then there's also Dr. Ratemo, who's also at the Secretariat, and we can work together and see how we can streamline that. Thank you so much. It's been quite a pleasure and a learning experience for me to listen, to see Dr. Aden. That was amazing. Dr. Gad, the way you guys work together back and forth, that was really cool. So thank you so much. I truly appreciate that.
All right, thank you so much, Dr. Lucas. Anushri, maybe you could just give the closing remarks. Anushri is the project lead at the Young Pharmacist Group. Welcome, Dr. Anushri.
Thank you, Hezron. So I'd like to give a brief thank you to Dr. Aden and Dr. Gad. That was actually a very well handled briefing. And Dr. Lucas, thank you for your remarks. I hope everyone pays attention to how you build yourself professionally as you go in. Remember, your internship is also a place where you're going to be now putting out your professional reputation and how you're going to be recognized by the industry. So please make sure you're putting a lot of effort into it. I have one question to answer by Stacy. I wanted to add on to what Dr. Lucas said. He did mention knowing the space if you want to go into non-traditional practice of pharmacy. Also creating your LinkedIn profile and networking, and just not networking between pharmacists, but also MOs and other healthcare professionals will give you a good idea on how to go about non-traditional practice. You'll be surprised by how much information they're willing to give you. We'll touch a bit more on that tomorrow. I want to try and keep it brief as we're already past the time limit. Now, a brief breakdown of what's going to be in tomorrow's session. We're going to go through the breakdown of roles that you're all going to rotate in when you're coming to internship. As mentioned, there are 4 major areas of internship rotation, where you have your PHC, you have hospital, you have community, and you have industry. There'll be some roles that will be very, very new to you, and they might not be covered during your curricula in university. So we have professionals from these industries who are going to be stepping in, pharmacists who already practice in these areas, to give you a briefing on what to expect, so we can build a really good foundation of knowledge for all of you. And number 2 is going to be financial wellness. Now, as you know, as interns, you're going to be paid quite a lump sum amount of money. It's important to know that the market after internship isn't that great. There's a possibility you might not land a job immediately. So we will go through the basics of financing, and we'll go through your savings and investment options with the money that you get. So please do tune in, and congratulations once again. Yeah, and Godspeed, everyone. I'll hand back to Hezron.
All right, thank you so much, Dr. Anushri. So I think we've now come to the close of the session. I wouldn't want to speak more because I think we've already done, I think, more than 2 hours, I think. Yeah, so we'll be meeting tomorrow again, same time at 7 p.m. Please join in on time so that you don't miss anything. And also, if you have any questions, just keep them for tomorrow. They should be able to be answered. Once again, thank you all for joining. For our presenters, Dr. Lucas, Dr. Nushri, Dr. Aden, Dr. Gad, Dr. Cohen, thank you so much. And also you for the attendees, thank you so much. So have a good night and see you tomorrow.